One of the first places we start with an assessment for somebody who has a possible concussion is looking at their dynamic vision. We're not talking about actual vision, we're talking about the coordination of two eyeballs with 6 muscles on each eyeball that is responsible for you being able to see and follow objects that are moving. And we use right eye for that. And during this test, right eye is looking at this patient's ability to do a smooth pursuit in a horizontal plane, a circular pursuit, which we saw before, and also a vertical pursuit, all of which can tell us a lot about what part of the brains have been injured from a concussion. Okay, so what we're going to do now is actually work on improving the patient's dynamic vision. And there's a lot of different deficits they could have, but one of the most common ones is that the eyes are not aligned properly. They're not teamed up as a pair, and so you can have some deficits that cause dizziness, head pain, brain fog from that. And so we're going to work on the gaze stability in the horizontal plane. And so we just have the patient look at the center dot, and we're going to put lasers on the cerebellum, and we're going to very slowly move them about 15 degrees while they stare at the dot. And this actually retrains the eyes to work together. So we do this in the horizontal plane, and we also do it in the vertical plane as well. Some of the other things that we may do with patients is actually getting their ability to fixate and then follow a target close to their face, convergence. And another thing we may do is have them cover one eye. And when they cover one eye, we can use this to either bring an eye out or an eye in. And all of these are useful in concussion rehab. So another thing that we have to work on with concussion patients is their balance and their coordination. One of the ways we do that is by doing dynamic exercises. In this exercise, the patient is keeping their eyes fixated on the target while doing a complex crawl, cross-crawl movement of the body, and at the same time working on balance, vestibular, and ocular. So this kind of ties everything together, is an essential part of concussion rehab.